cholesterol is used as a building block for healing in the body. Now, if it's not used properly, it's going to plug you up and raise your blood pressure. So we'll do phosphatidylcholine, which is lecithin, injections, and get blood flow to increase in people's blood vessels. We've used that for a long time, along with chelation usually. But there's just interesting, weird things that you come across that I think everyone should know. Here's another one for you. You know about glycation, diabetes, blood sugar in the wrong places causing all kinds of problems. Study done in the United States with the NIH chelation study. They followed patients for 8 years. They found by getting the toxic metals out, they were able to reduce the glycation events, that whole losing your eyesight, peripheral neuropathy, pain in your feet, all those things dropped 30%. That's like, okay.
Welcome to the Too Curious MD podcast. I'm Dr. Ali Ahmed.
And I'm Dr. Soraya Rahman.
With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in.
Welcome to the Too Curious MDs podcast, where we explore the world of integrative and holistic medicine through the lens of narrative medicine, the stories of healing from both sides of the equation. Today we speak with Dr. David Wikenheiser, or Dr. Wick as he is known. Dr. David Wikenheiser is a licensed naturopathic doctor who has a clinical focus on natural and regenerative medicine. He enjoys sharing his common sense approach to regaining and maintaining your good health. Dr. Wick was born and raised in Kelowna, BC, where he now practices, and he enjoys researching and implementing new technologies into the health programs he offers his patients. Welcome to the Too Curious MDs podcast, Dr. Wick.
Thank you so much. I must say it's a little odd because a lot of MDs apparently are not that curious. So, no, but everybody's curious. But I think most MDs, as you know, are probably exhausted. And so that's hard to be curious when you're exhausted.
Absolutely. I think being in healthcare right now, we really love reaching across all of these different silos and divides to really learn what we all have to offer each other and the perspectives. And you've been in practice now for
I graduated 30 years ago, and time flies when you're having fun, so I must have had a lot of fun. But I've learned so much more since the 4-year naturopathic degree because I love going to courses. I love soaking up information. And it's quite funny because some people say, well, you're a lifetime learner. I say, well, maybe, but I'm definitely compulsive. I soak up information. I have a lot of questions. I mean, I'm sure you guys do too, where we just want to know more things. And I'm shocked that so many people don't have questions. They don't even think about questions. Well, I can't turn it off. I just have to ask a lot of questions. And with some of the new technologies today, some of the AI, I can actually data mine my ancient textbooks even. This is kind of cool. This is really neat because I can get information for people that matters.
Yeah, I love the word data mining because it's like you're digging and exploring and you're rediscovering something ancient that's valuable, that has that metaphor for, and it's exciting, right? When you mine I think, I don't know about other physicians, but I know I've always been very curious. And I think when we wrote up the idea of this podcast, the curiosity of science and the curiosity of learning, the curiosity of creativity, the curiosity just feeds so many elements of our existence. And it's hard to not have it. But then there is so many places where you see that that's not there or promoted or encouraged. And medicine, we kind of get burned out too.
Well, you're so focused on delivering and delivering what people want, and what that's determined by usually is advertising. And so they just want the latest, give me the latest drug. Well, maybe that's not the best for you. And they just want to solve their problems. And then you want to get through the day. And how curious can you be? Well, I totally applaud you both, because to maintain that curiosity is not easy. You got to have energy. And sometimes people say, oh, well, are you working on a weekend? I say, well, I'm not seeing patients on a weekend, but I've got so many other things to get through. I've got these courses and that course, and I've got 4 more books that I just got ordered in that I need to read. And so now, yes, I know. I know you guys, yeah.
You can totally resonate with that. And my number one question is going to be, what are the names of those books and what gives you that excitement to read more and learn more in your
Well,
work that you're doing?
I'm fairly sensitive. I'm a guy I'm not supposed to be, but I am. And I'm really sensitive. I take it pretty hard and it's really personal. And I know you guys do too, when patients don't get results. And I've got a lot of patients, they're not supposed to be relatives and friends, but hey, you got to help immediate people. So I'm really motivated by getting results because I take it pretty hard when people hit the wall, when they burn out.
Yeah.
And a big part of what I do is regenerative, meaning joint regeneration. Although it doesn't just stop there. I've got so many new things that I'm just gotten into in the last 6 months even. How do we get people to be the best they can be? This is a philosophical question, but it's a very practical question because how do we actually deliver that to our patients? That's what I'm working for. And I get a real boost. Maybe it's a dopamine dump, whatever. I'm getting a real boost when I get a solution. I've been working on that solution for so long. Now, I have a saying, a lot of what I've learned in about maybe 6 seconds. Sometimes it's taken me 20 years to get to the 6 seconds. Right?
Yeah.
You guys are the same, right? You've been working on a problem for so long, and finally the answer pops up, and you're just so excited. I've been waiting 20 years for this.
Yeah. Yeah. That is so true. And it
You
comes
got to ask
together
the
so
questions.
naturally when those 6 seconds arrive. It's like they have arrived.
Poof, it's a tipping point. It's like, oh my goodness, I got the answer. So
Yeah.
one thing I do is ozone therapy. So
Yeah.
that's a way of stimulating healing. And one of the teachers that I've gone to, and I'm sure you guys are familiar with, Robert Rowan.
No.
So, so he's one of the top 2, I consider ozone trainers in the United States. Frank Schellenberger is fantastic. Robert Rowan is fantastic. They did a presentation through Dr. Rowan's office. I've been to 3 of their trainings. And ozone, I'll talk more about it in a moment, but went to 3 of their trainings before and they did an online one. So you know who, and I think in question, so you know who invented alternating current? Well, that was Nikola Tesla in about 1890. Who's the first person who created energized oxygen, ozone? Nikola Tesla in 1890. And who's the first person who ozonated glycerin? Nikola Tesla in 1890. So during and I've been doing ozone therapy. Last March, it's 29 years. And it's so cool for stimulating healing and turning on the natural ability. Well, I didn't know about ozonated glycerin. So they're talking about this at the presentation, and they cited a book that I subsequently bought, and it's from 17th edition, 1907. And what they list and what they're treating. Now, ozone is really interesting for me because it turns on natural ability. For your listeners, so cytokines are the chemicals of healing, whether that's trauma or infection. Remember, people had cytokine storms when they needed to be intubated with COVID infections, being hospitalized. So our trick is to actually activate the natural healing ability of a person by introducing energized oxygen. Now, that can have some challenges if we're regenerating spinal discs, which has been done in Europe as long ago as 40 years ago. So that treatment that I learned coming up on 30 years ago, I was board certified after I learned some of the treatments. You introduce the ozone into the body, inject it, but you got to freeze first. So we use procaine and B12. And then you introduce the ozone. It creates an ozonide that modulates the cytokines. So this is a natural way of turning on healing. Well, now the ozonated glycerin, the ozonation, now there is some pain when you create the ozonides, but that pain isn't present when you do it in glycerin. But the glycerin, being a sugar, is sucked into the body, and it's phenomenal, turning on healing and regeneration, skincare, internal. I'm just very excited because we're not forcing healing on the body, we're supporting the natural healing cycle.
Which is really, now that we've kind of discovered this art of understanding the way healing really works, it's not really that you take it away, you actually support what's there.
Or
And you
force
really
it.
encourage or force it or encourage it or activate it in a very natural way, like you really push it to what it can do. Tell us more about how this works in the joint system. I'm fascinated to learn, and I know peptide therapy, all of these, the new, I mean, I don't know if it's new sciences, but really thinking about things outside of the box of medicine is really what we're really talking about. We don't have to be prescriptive, but we can really think outside of the box and describe to us what that looks like when we talk about ozone and regenerative joints.
So when I'm regenerating tissues, I have a couple of questions. And again, questions
Yeah.
just pop into my head. When people come in, I have to know, are they broken or are they out of gas? Now, too many people are out of gas, and quite often you'll reinitiate healing by giving them more energy. Now, that can be as simple as straightforward diet and certain nutrients. NAD is really important for energy, and so we use a lot of that, whether it's in pill form or injectable. The first thing, of course, assess. I have ultrasound training and I've got a machine. So, what is really going on with that particular joint? Then we need to feed the system, and there's certain supplements that we do to feed and then stimulate. Maybe that's ozone, maybe that's platelet-rich plasma to initiate the healing cycles. And then there's follow-up. There's different things to nurture the healing ability of nature. So kind of straightforward. Just feed, get the blockages to healing out of the way, get them to stop doing things that they should. Here's a saying for you. I believe all healing, all medical problems are because of a pronunciation error. So this is a joke. So
Mm-hmm.
what do you mean a pronunciation error? It makes sense in a moment. The pronunciation error of the inability to say no. So how many people are overdoing it because they made commitments that they never should have, but they can't
Yeah.
say no, and they're overcommitting. There's no boundaries, there's no expectations, or the expectations are unlimited. So I mean, in you guys' lives, how many times have you done something that you overcommitted and you knew it even going in, but you felt him, you had no choice. As doctors, we do this maybe all the time, but I think, well, maybe.
Yeah, I'm interested to hear. Tell me a little bit about the patients that come to see you in Kelowna. Like, what's a kind of hallmark patient that you find comes to you and finds relief from this kind of treatment?
Well, it's a bit of an interesting circumstance in Canada because we have socialized medicine, which there is a limit, of course, which means you can have anything, any type of treatment, but you're probably going to wait 2 to 3 years. And so there's a lot of delays. There's a lot of delayed care, which is not the greatest. So I get a cross section of people, typically mature individuals, although I deal with quite a few children as well, but mature individuals, unfortunately, are frustrated with the system. They're tired of waiting, they're tired of being delayed, and so they want a system that cares for them. And actually, too many people have not been listened to. They're, this bad joke of get out, don't mess my hair. It's just like, what can I do in 2 minutes? Well, I can give you a drug and say goodbye. Yeah, but my mother is 90. She goes to her doctor, and I counted when I went with her 9 signs, little signs in the exam room that said, one visit, one problem. Now that
No.
makes me crazy because by the time we go through their third, fourth, fifth problem, they all overlap, and I don't know how I can separate them. They all have to be treated together.
Yeah.
I mean, I'm sure you're going through this personally because this is a challenge that every licensed medical professional is involved with. So are
Yeah.
you guys experiencing this as well?
So there's this kind of like moment we're in right now is
Mm,
where people are, I think, and you've been in this for decades, but I think it's getting to a point where the systems have definitely not served the needs of the people who
mm.
are reaching for help. And there's a greater complexity of the conditions that we're seeing in our populations, which is why I wanted to know, how did you come to discovering this treatment and kind of putting those two things together, right? You had the patient population, you had these patients who were suffering. They had all of these overlapping chronic problems. They'd been frustrated by the system because there was no one shot answer to what they were going through. And here you were saying, no, I want to do this differently. So how did
Well,
you get those two things to connect?
so I was trained, as we all were in school, to solve problems. I mean, my core competency is pattern recognition. What kind of pattern are we encountering here? That's why I have to ask more questions. I really need to know where we're going, where they came from, where are they going. And then from there, I was frustrated when I got out of school because how do I actually look after people? They gave me a certain level of competency, but I'm attracted to going to more courses because I hear stories and, oh my goodness, I got to go to that course, bring home that skill. Go to another course, bring home and meet more people like yourselves that have solved these problems because really we're solving our own problem by learning more skills. And so most of the people that I care for have come off referrals, which is the best kind because I know that I got along with who's referring them, and they know what to expect. It's not just a surprise. Very rarely do I have someone come into my office not knowing my approach, which you start with nutrition, get rid of toxins, stop consuming something you shouldn't be. And in our culture, that's not easy right now. And that's why I struggle with some of the
Right.
adolescents and even young adults that are vaping. I mean, this is just not a great idea. And
Right.
so certain blockages to healing, we've got to negotiate our way through that, get them healed up, at least in the intestinal tract, and then move ahead to using other therapies when they're ready to get some real regeneration. This is why I love using ultrasound. I was looking at a young man today. He was playing hockey, got really strung out on the goal. He went around behind, he's only 30, went around behind the goal, got hung up on the goal net, and was moving so quickly he stretched himself. So his pubic symphysis in the
Mhm.
front is in pain. Interesting. Let's have a look. Look with the ultrasound, and wow, we got some work to do. His opportunity for improvement is big. We can really make a difference feeding the system, stimulating it to heal, and getting his pubic symphysis right in the middle of the front, as you know, to regenerate, because that throws off both hips, throws off his back, his knees, all over the place. This moves all over the place, that problem. So to actually be able to look, that was a big deal for me to get ultrasound training about 15 years ago. So you actually go in and see the problem. This is so cool.
Yeah. I can say the same thing when we do like QEEGs and we can actually see the dysfunction,
Yeah.
and it's hard to see a brain, dysfunctional brain, right, for patients, but it's so validating.
Yes.
It really validates the pain. It really validates their situation. It validates how they feel inside, and you can relate to it and connect to it with technology or with even the human touch, the doctor's touch, the healer's hand.
Hmm.
That itself gives connection to somebody's pain, right? And I think that's part of the healing. At least that's what I see. That you need share to that healing space, and then share to that understanding of that. It's such a sacred connection to have with your patient. Um, to
Well,
have that,
cutting edge technology, which is what they're looking for. How do I
yeah,
solve this problem? Is it even possible to solve my problem? Reassuring, taking full history, tell me your full story, then offering solutions and being present. And
yeah,
actually, well, I take pages of notes. So listening and making notes and to have them heard, which of course their family and friends are tired of listening to their problem. They've told everybody and they don't want to. I'm sure, in many cases.
yeah.
And so then we listen and tell them about technology. For you guys' case, you're talking about EKGs. Well,
QEGs,
QEGs.
yeah, quantified EEGs, yeah.
So that actually numerically gives them the information. Now, here's the next part. How many changes do you see over time and with therapy? Are you noting positive changes?
Definitely, and when you do stimulation treatment,
Yes.
like you're doing with ultrasound or with other ozone, when you can actually track a function of outcome and measure that
Yes.
and see that over
Yes.
time, yes. And to have a quantifiable way to see it, I think really also ensures, the practicality of this approach and because we're really cutting edge, right? We're really doing things on the edge of normal, I guess, whatever normal
Yeah.
is.
Right.
So you have to be able to assess that. And the technology, we have technology, why not use it? We have AI, why not use it? We have ways of really enhancing what we do with that curiosity, I think. And I think
Yes.
keep that, ask those questions. It's okay.
But that
What are the
human
ways that you
touch that you're talking about to really buffer between the technology and them,
yeah,
and in the end, they just wanna know, "Can you help me? I
yeah,
love what you showed me. I don't understand it, but can you help me? Are you sure?"
yeah,
And it's like, "Well,
yeah,
Yeah.
let's watch your progress with the new technology."
yeah.
Yeah.
They get really excited. It's
Speaking of
pretty
progress,
cool.
yeah, yeah. I want to know, you just mentioned something that's really kind of resonating with me, that there's chronic problems for which this therapy is useful, and we're just focusing on ozone therapy. We haven't even touched on PRP and prolotherapy. And then you're also talking about acute issues for what it works. Tell me about when all this as you're talking about testing and assessing, right? We're saying assessment means you check the situation before you do the treatment, and then you check afterwards. And what's really interesting here is we're just in this time now where we can get all of this rich data
Yeah.
off of each patient. versus before where we used to have to pool data and do statistical regressions and things like that and try to really come up with a cohort that would try to mimic what's happening in real world. So we're now in this kind of like shifted over state as physicians, as healers, as people in this interface of let me solve the problem that the person is coming with instead of the need to diagnose and label and all of that. So tell me about, between acute and chronic, what kind of timelines are we talking about here when you start to see improvement?
Well, it depends always on the problem and how much involvement the patient wants in their own care. So this is where I skew it a bit because I really work with people that are motivated. I've had a few people show up and they have said right at the start, I don't know why I'm here today. I said, okay, well, why are you here? Well, my wife told me to be here. Well, if you're not going to be actually involved and looking for problems, you're just trying to placate a family member, I don't think I can help you. But if you're really involved, now we can do physical exams. We can look at things. We can do lab exams, all those things you're talking about, instead of dealing with an entire population, but with an individual. By allowing yourself the ability to actually be in the moment and look at their results, not a statistical average. Well, there's a 5 out of 12 chance that you'll get better if you take this for 3 months. It's like, no, let's look at this. Now, let's look at ozone therapy, for example, as an example. There's different ways of applying ozone. You can limb bag, you can put it on the surface of the body. This isn't happy, but it's to talk about, but it's really good. We rectally insufflate. So putting it up the rectum, it will react with the lining of the large intestine and actually optimize natural killer cell activity in the bloodstream. Pretty cool. I don't do a lot of that, but I do that for prostate cancer and some breast cancer patients as an adjunctive treatment. Then we've got one where I inject joints or just below the surface. I'll talk about that in a moment. And then I've got another one where we draw out 200 mils of blood, ozonate the blood, put it back in. We do that 10 times. That's called 10-pass ozone. Now, what I've noticed over time, when we inject microdosing, 30 gauge half-inch needle, tiny little needle, just under the skin, we watch for 3 results. Number 1, what do they feel? Because people will feel nothing, all of a sudden, oh my goodness, that's where the chemicals of healing cytokines are backlogged, and they'll have point tenderness with the injection. Now, we also notice that they bleed more there. So I'll be dabbing a spot where there's more of a backlog. And of course, they'll have more pain. Now, it's about 4 out of 10. So if I do an area, there'll be nothing, oh my goodness. And then there'll be a total area that I'm injecting. And then as they resolve every week. So the healing cycle of nature is 7 days. So I see them 7 days later. Do it again. And you watch the area expand and then contract, expanding, contract until pretty soon they don't react to any injection. It's not just that they got better. It's not just that they have healed. It's that, or that they've adapted to it mentally because they know the relief is coming. It's that they actually processed out the cytokines. They've optimized. And of course, pain, redness, heat, and swelling, inflammation is just signs that the cytokines are backlogged. So when you get them moving, you know it's moving ahead. Now, this is really colorful. When it's chronic, they may have some pain, but they don't have bleeding. So part of what we're up to is to stimulate them so that it comes from a chronic situation to a more immediate and then resolves.
And I imagine the cytokines are just one cell line of cells. And you mentioned, PRP is, or platelets and other cells or cell lines. What are the other ways of enhancing kind of natural responses to illness or conditions?
Well, if we're talking about joints, which for me, mobility is a big deal for a lot of people that I treat, we need to feed their system. So there are straightforward supplements like MSM, which is a white powder, methyl sulfonomethane. That's a white powder that enhances the elasticity because we don't want you just to heal. We want you to heal and in a way that you're more elastic. You won't re-injure that joint. So MSM is an oral supplementation, pretty good. One chemical change from there is something called DMSO. It's dimethyl sulfoxide. So DMSO topically smells a bit like garlic. So we feed the system so that they've got the building blocks to heal. Then we stimulate them, and then we'll watch later. Now, there's many reasons why a person may have joint pain, and injury is a big part of it. Infection, there's other parts. But for us, we're looking at how do we regenerate that tissue, make sure that they're moving better, and they've got their life back.
Yeah. I'm curious as to how you approach an inflammation versus I guess, production or transmitter deficiency, nutritional
Mhm.
deficiency? How do
Yep.
you decide somebody comes in with, say, pain, fibromyalgia, for example? How do you decide what is the best way, which cell lines to kind of approach here?
Okay, so comes out of the questioning. What is their diet like? What's their nutrition? So, have you heard of the Myers cocktail?
Yes.
Okay, so I learned that in school from Alan Gaby, Dr. Gaby. Phenomenal. So many people respond to that, and that's just the way we do it, magnesium and B vitamins, but they don't have enough. So you simply top them up, and then we can see what's still there. And there's other things like you're talking about peptides, cell signaling. So they're, in many people, possibly more productive than hormones. And so you're looking at feeding the system, stimulating it locally, but then modulating all of these different aspects of healthcare. We've gotten some phenomenal results lately with the BPC 157. That's
Yeah.
worked out so well for a variety of problems. And I
Mm-hmm.
know it's on the market and a lot of people have got opinions about it, but I think it's useful. As a concept, I think it's important for all of us to be modulated properly. I mean, how much is 5G really affecting us? How much is it really suppressing these natural abilities to heal? It's a huge question.
Yeah.
That's so
Tell
much
us more.
information. I'm sorry. I'm going to
Yeah.
ask for one
Yeah.
one thing. There was definitely we're hearing about the merits of ozone therapy, and as you're talking, I'm kind of, really sitting here and kind of understanding. There's acute and chronic. There's different parts of different syndromes like tendinopathies or osteoarthritis or fractures and some complex regional pain syndromes and things like
Hmm.
that. What are some of the, as you've been practicing, tell us a little bit about maybe the other side of it. When has it not worked? Or what are some of its drawbacks? What are some of the side effects that you discuss with your patients as you're getting them
If
ready?
if people are too exhausted, they're not going to
Mm.
respond. You can only stimulate the potential that's there. So if they're backed up with all kinds of toxins, if they have not eaten the right food, we got to start there. Another big one is what we've seen a lot in stem cells. I went through stem cell training in 2012, and it was a gray area. Naturopathic doctors in Canada were doing it. I wasn't quite as innovative enough to apply what I've learned. It became black and white, and they said no. But a lot of people have done stem cell treatments that haven't responded. So it's similar to doing ozone, similar to PRP. When it doesn't work, it could be because they've got an underlying infection that's blocking the healing cycle. So we've got to optimize it by getting down their deep infections, which of course lead to, there's a whole cycle with autoimmune based upon deep infections. And I'm shocked by how many people have deep infections. I mean, you do different tests out of labs in the States. We send a lot of stuff to the labs, doctors' data for some intestinal stuff.
Yes.
We'll
Mm-hmm.
use other ones out of Arizona. Um, oh, and it was almost in my head there. But there's a number of labs that are telling us about deep infections. And I'm shocked, maybe not shocked, but I'm a bit surprised how many people have got deep infections, and that's
Yeah.
triggering their autoimmune. How are you guys doing with deep infections? Are you finding the same as me? A lot of people are surprisingly infected?
So we do ketamine treatments, and I do
No.
integrative medicine and combine that option for patients because the mind and the body, the spirit, emotional state is all related, right? How can you
Yes.
dissect them out?
Mm.
So when it comes to observing them, or even evaluating a patient before treatment, yes, it's important to recognize what's the source,
Mhm.
where's the inflammation, looking at their labs, getting those numbers so you know where they are, right, in that presentation, and then observing that treatment response with lower inflammatory reactive, CRP goes down. You're supporting their nutrition, so of course their B12 improves, their vitamin D, these are the very basics. So I think it is important to bring that into the healing space, right?
And inflammation and infection, there's like such a, kind of transition. And then we want to bring in the gut microbiome as well.
Oh.
Right. And the impact it has and all that we're discovering about this.
Yeah. And OCD and C Clostridia, I've seen many patients with
Yeah.
that, right? And the correlation is so strong that if you don't look for it, you won't treat the OCD.
Right, you miss it
Uh,
completely.
Yeah.
So let me give you one here. This is something I got involved in a few years ago, and it has to do with physical but also mental looping. So I don't know
Yeah.
if you've gone to courses with Marty Hintz. He's an MD out of Duluth, Minnesota. So he was selling or promoting his course at one of the orthopedic conferences I was at. And it really fascinates me because I'll give you a little bit of a rundown on this. So in that world, it's not complete, but in that world, serotonin and dopamine, two major neurotransmitters. So serotonin, when you don't have enough, you're at risk of anxiety, depression, poor digestion, poor sleep. And then without enough dopamine, you can't stop. You loop. So you're going through these tight loops. So with a Parkinson's patient, no dopamine, they're in resting tremors until they lock up. Now, I've treated a wide variety of problems by simply feeding the dopamine cycle and getting them out of their childhood loops. Everything from just simple mania, however you
Yeah.
define that, right
Yeah.
down to polycystic ovary syndrome, in that when you get them into real-time feedback with their hormones, they start ovulating properly because the hormones from the brain, luteinizing hormone, others, actually have an effect. So they're not just looping off into space. Pretty cool to just basically feed their brain. Now, the ketamine stuff is beyond my scope, but I've heard great stuff. Similarly, how do you get people to reset? So I applaud you for doing that because that's pretty cool.
Yeah, I think we're all kind of approaching how all these complex systems in the body interact and are
Mm.
dependent on each other and have coexisted and co-regulated. And we've looked at it all from this, the textbooks are always written in chapters, and each chapter is a different system of the body. But where does it all kind of come together is on the body of the patient.
And
And
in
as
your
I'm
exam
hearing
rooms.
this, and in your exam rooms and in your questioning,
Yes.
why is this happening? Why am I seeing this? Why are these two patients so similar and yet so, react differently, for example? Can you tell us a story about kind of like a conundrum that drove you to search for some of these answers and some memorable maybe anecdotes or
Well,
stories?
let me give you another one that's physical. Okay, so I'm challenged by patients that don't get well. So I go and take more courses. So I had a patient that we were treating for Parkinson's, and I knew him from a Rotary Club. He's a retired dentist, had to retire. And so we were looking after him and putting him on the HINTS protocols and feeding his brain. He's doing way, way better. But then the rest of the family comes in. So I'm looking after the wife, who they had an acreage, and they're both farm people type thing. So she was riding her horse down the driveway. Of course, it bolted for the barn. She got shucked at the gate and contacted the post hard. So she's
Oh.
now got a plate in her right arm, and she pinched nerves in her back. And so we're looking at neurotransmitters, different things, how it works. But then nerves were pinched coming out of her mid back at the level that innervates the heart. So we did something called nerve hydrodissection. So that's just D5W, dextrose 5% water. It resets nerves, but you use the ultrasound, you go in and see where the nerves are stuck in the fascia, and you inflate it and release the nerve. And she came in one of the sessions, she had her blood pressure was about 212 over 108. We relieved the stuck nerves, and when she got up off the table, we tested again right away. She went to 142 over 87. So it's like, okay, that was a pinched nerve. That was not a medication problem. That was a physical pinch. Now that's pretty cool. Her blood pressure's now is fine. I saw her last week. But the big issue here is, what's truly the problem? Is it just she's got an undiagnosed deficiency of some neurotransmitter or some drug like Prozac? That has its place. I'm not saying it doesn't, but too many times that's used because the clinician hasn't gone to enough courses, isn't looking further, isn't going to the next level. And now I'm not
I
saying that
love
I'm
that.
better than anybody else. I'm just more compulsive, perhaps. I mean, we're all compulsive. I mean, we would not got to where we are now if we didn't go further than others. But I don't care about others. I care about what I need to do for my patients. And so you go
Yeah.
to another course, because I'm always scrolling. I'm a buyer is a buyer is a buyer. I buy courses. So I'm always going through courses and scheduling time to go through the material or traveling to see a lot of courses. And there's just some great courses. I did one just before our call here. And wow, There's new information all the time. So you apply that and watch the look on their face when they see that we've got them a solution that works for them.
Yeah, I love that. It's almost reminding me where we kind of, as physicians and healers, have to go back to basics. When we think of hypertension, right? And we
Yeah.
do the differential for hypertension, we're taught in our really novice state, think of pain, think of other reasons for hypertension than just essential hypertension. Think of conditions that may upset the homeostasis of the body, as you basically deduced in this patient, and how to then put those two things together with the anatomy and have a technology to help. It's a simple technology. It's skill, really, that you're
It's physical
describing.
medicine. It's not that advanced. Well, here's another one for you. Are you familiar with the glycocalyx? So this is the lining of so have you ever handled a fish that was slippery? Everyone has. So that slipperiness is the sugar calcium, the glycocalyx, that's on the fish lines our blood vessels. And we've got these little frond fingers. So what is essential hypertension? Well, it's a blood pressure going up. Now, is that because that well, it's because you're not getting enough oxygen, your heart's trying to compensate. But why? Why are the blood vessels more constricted? Is it because the glycocalyx broke down? Maybe. So there's ways of measuring that and actually feeding the body to be better. Now, here's another one for you. Cholesterol is used as a building block for healing in the body. Now, if it's not used properly, it's going to plug you up and raise your blood pressure. So we'll do phosphatidylcholine, which is lecithin, injections, and get blood flow to increase in people's blood vessels. We've done we've used that for a long time, along with chelation usually. But there's just interesting, weird things that you come across that I think everyone should know. Here's another one for you. You know about glycation, diabetes, blood sugar in the wrong places, causing all kinds of problems. Study done in the United States with the NIH chelation study. They followed patients for 8 years. They found by getting the toxic metals out, they were able to reduce the glycation events, that whole losing your eyesight, peripheral neuropathy, pain in your feet, all those things dropped 30%. That's like, okay, solved the real problem. The real problem with the toxic metals, because the rest became less of an issue when you got it out. Now it all matters. You have to eat properly and do all the things you're supposed to. But if you can have an intervention that makes that kind of gain, wow, pretty cool.
Yeah.
Inflammation of all kinds interacting.
Yes. And it's not
Yeah.
just inflammation, because I've been to lectures where people say inflammation is terrible. And I'm saying, well, hold it. You can't have healing without inflammation, but it has to be fed and it has to be supported so that it doesn't just sit there. Your
Yeah.
C-reactive protein goes through the ceiling. I mean, why? What's your blockage to healing, and can we stimulate this to get the job finished? Here's another one for you.
So
I'll
we're
give you.
talking about like the cycle. You kind of have to
Yes.
complete the circuit
Yep.
in the body.
Or just keep looping where you are.
Yeah. And that seems to be some sort of a principle in the body. Like, I think that's what we're connecting with. That the body has an ability to reset. The body has this ability to expose problems that are happening on a very molecular level, at that systems level. And how do you then treat something at the molecular level? You have to approach it at a systems level. I feel like that's what you're kind of dancing with here.
Yeah. To the limit of the patient. Because some you can do this right away. Other people, you need to hold their hand and walk them through stuff, because it's like they can't get there, or they don't have the budget, or they're just not committed. You guys do it too. The art of medicine is really getting patients out of their own way.
Or us getting out of the way too. I mean, and
Oh,
really
we're
just
standing
paying
in the way enough
attention.
too. Oh, yeah.
Right.
And really paying attention to what's being said, right? Wow, this sounds like really amazing. I'm filled with more questions than when we started, and I think I love how you remain curious about your patients and you really go and search out an answer. And it's almost like detective work, right? You're kind of investigating and really thinking about, well, what's the source? And then what approach should I use with this? And I think that combination
So let
is
me give
where
you another one here.
the art is.
Okay. So we know that the nerve roots out of the spine go to the tree, but there's 3 bundles. So within there, so innervation goes at each level to internal organs, skeletal muscles, and the skin. And so you'll get skin changes. If I look down the back, I can see where they've got a spinal disc problem because the hair changes there. Now, here's another one. I'm looking at you guys. I look at everybody.
Yeah.
Lateral lines on the neck conform to pinched nerves in the back. We'll take the ultrasound and track, and we can see where they're torn and where we're going to regenerate tissue in the neck. Maybe I'm bored at lunchtime, but I leave the office.
I'm feeling like I need a little bit of an ultrasound right there.
I'm feeling I'm going to need to get a consult.
Well, we're all like that, but we're watching and you're saying, and I catch myself being odd. I mean, yeah, I know we're all odd, but at lunch, and I do all kinds of IVs, and you're always watching when you're doing IVs, who's good, who isn't, how do I work around this? Oh, I'll never get them because they just don't have prominent veins. That'll be easy. So I find myself daydreaming at lunch. I go and I've got private self-time, and I'm watching people, and I find myself, I'm looking at their elbows, because that's where we use, and I'm going, they'd be easy. They're good.
Yes,
and I'm going, oh my goodness, what am I doing here? But you guys catch yourselves doing that too. You're checking out people going,
right?
I do it to my kids. I often do it to I palpate them. I'll say, that's a good one.
Yeah.
And my husband says, stop it.
I can't do that.
You got great veins, honey.
Yeah. Oh, you'd be easy to do.
Yes, I love that.
But that's part of the thrill.
It's like this. There's a dopamine fix with that, I'm sure.
Yeah, Mom, you're checking me out again. Yeah, I know. I'm just checking. Yeah.
Just checking out your veins. I love that we're talking about the body as this, and I've always thought about this. We are taught so intricately in the early, in our medical education. I think I'm being brought back to how we're taught in medicine, because actually when we're starting out, we're asked to look at everything. Physical exam is kind of front and center. Like you're talking about, when you observe, you take in so much information. And I feel like we don't teach that anymore, and we don't give importance to that. But there's so much that we can get from just looking at the body, like you did, like observing this is happening and that's happening. How are those two things linked? Does it make sense? And then pursuing that question.
Well, there's so many different aspects of this, right down to a nutritional physical. How is somebody presenting just what you can see, and where's their nutrition? I mean, and it's relatively simple, but it's other parts like liver, kidneys. Here's one for you that I don't know if you're aware of, but so many women want big lips. So the lip fullness is an indication of adrenal sufficiency, which is rather ironic because a lot of women burn themselves out, get thin lips. Now they want it pumped up so that they look healthy. Well, I don't want you to look healthy I want you to be healthy. So how do we support your body so that you will have the inner glow, so you have enough energy flow so that you'll be the best you can be? Now, I threaten people. Believe it or not, I do. And this threat is, how long are you going to live? If you live to 88, 90, are you going to do it on your terms? Because the control now, I believe in destiny. You're going to live as long as your destiny. That's between you and your God. I'm not going to, I'm not involved in any of that. But what happens if you live longer than you want to because you didn't take care of yourself? So my threat is, take care of yourself now, because you may live longer and you're going to be here the whole time. So come on, let's get stuff, deal with your liver, deal with your microbiome, eat enough to feed your brain. Stop starving yourself silly because you're some fashion aware person. Just do what needs to be done and focus on what really matters, which in the end is relationships, family, friends. Who's good?
Back to the base. What would be
Always.
a cocktail, I guess, of something that you would recommend for somebody who has IBS or who has dementia, or just an idea of a basic thing that you would say really is a basic process to begin with, and then of course whatever condition.
Okay, so let's give you a couple of quick rules. If you're eating food, we all are, and it's crunchy and it didn't grow crunchy, don't eat it. So a lot of that's boiled in oil. So French fries, not so much. Not a great idea. Usually the oil's rancid, and that's not good. So always start with nutrition. Various supplements like phosphatidylserine for the brain. What about huperazine? We're using formulas with that's really supporting the brain. And we're looking at membrane permeability. How well do you release neurotransmitters? Now, we need to feed them with good nutrition, such as vitamin B6 and good amino acids. So you need to make sure everything's in place. And then Stop poisoning them with foods that are not good for them. That's a huge deal. This microbiome that you talked about earlier, it's been estimated, I don't quite agree with it, but it's been estimated that up to 98% of our thoughts come from the microbiome. That means it's not us. It's the biochemistry. What are you craving? Is it to feed the candida in your
Yes.
large intestine? Well, I mean, we need to be aware of things. And the more sugar you eat, the more you'll be addicted to sugar. So
Mhm.
whether that's dementia, if we're looking at certain other aspects of someone's got irritable bowel, well, there's
Mhm.
going to be some underlying infections. But so much of what we're up to, and this really gets me upset, is
Mhm.
factory farming. I have so many patients, I'm sure you do too. Where I am, there's quite a few people from Europe in the area. They go home. They go back to Germany or France in the fall. They go home to visit, not every year, but quite often, Eastern Europe. They eat all the wrong foods and they have no problem. They go to Germany and drink Hefeweizen wheat beer and have pretzels, and they're better in their intestinal tract than
Mhm.
they are here. They come back home, get on their restricted diet, and within 2 weeks, they're not good again. So how
Mhm.
much of it is simply factory farming, the so-called glyphosates, the Roundup,
Mhm.
and how much that alters our
Yes.
microbiome and really sabotages us? These are very real things.
Well,
Yes,
thanks
they
for
are.
bringing it back to 2025 because apparently all of those EPA standards have now been um,
Relaxed?
Mm.
relaxed, as you
Yes.
would say. And so our food is about to get even more dangerous for us.
Even more
Um,
industrial.
mhm.
Well,
Yeah.
that means that you have to run your own life and shop well. And if you can, not everybody can, but if you can, you need to know who's farming. And maybe that means that you need to do more in the home. I don't care if you've got an apartment, that you can do a micro stack of herbs. Take charge where you can and vote with your
Exactly.
money. Where are you buying from? Are you just going to buy from the grocery store that bought it from wherever? Or are you going to buy it from someone who's selling food that matters? And then you get into ethnicity, ethnic food. I mean, you guys, we're all ethnic, but your ideal diet is based upon your ethnicity. But can
Yes.
you get ethnically accurate food where you live? You got to shop well. It's not just your mom's and grandma's recipes. That is your best food, but from where?
Yeah.
Me, it's going to be Europe, Eastern Europe. That's the best. But I mean, can we get that? No. So you got to be really conscious of what is good health and how to feed it and stop consuming anything in plastic. And
Yeah.
soda pop and all these things. Oh my goodness.
Well, I definitely hear you. I think we do think in our brain, our thinking brain really is our gut.
Yeah. Oh
Because
yeah.
of course it would be you're feeding, your transmitter, your transmitters, your production line, your absorption line, your clearance line. And I mean, the gut has got so many different functions and it's a communicator. It's communicating, hey, this is the system I have to work with.
Yeah.
This is the fuel I'm getting.
Good or
So you
bad.
got good or bad. You
It
got
can
to work with
communicate you
this,
right off the road.
Right,
Y-
right. It
Well,
does.
this is
And
the
it does.
joke, and I'm not criticizing anybody, but you eat lunch at 7-Eleven 4 days in a row, and the fifth day, I
Yeah.
guarantee you're going back because that
Yes.
style of food. Now, the same thing works for natural, out of plastic
Yes.
food. That
Hmm.
I'm not criticizing any type of food. I'm criticizing people who just rely on one type forever.
Yeah. The diversity, lack of.
Critical.
Yeah, critical because we're feeding the gut again. We're feeding
Yeah.
our thoughts. So, how well? I mean, I know when I'm eating less gluten, not that I have gluten sensitivity or anything, but I know when I go out to eat or when I can, you can, I'm more attentive to what my gut is telling me. What does it notice? What I notice when is my gut happy with this? And really, there's a difference and you can feel it almost immediately. You
Well,
don't
if
have to
you're
wait a
watching,
couple of
yeah,
days. Yeah.
for those of you who are
Yeah.
watching, yes, it's like, here we go
Yeah.
again. This is
Yeah.
not going to be good.
Yeah. And isn't that the truth? The body kind of knows. Like
Mm.
there's kind of like a subconscious level of interaction happening that we may be unaware of in our conscious minds. Our conscious minds are reacting to, oh, what kind of packaging did this come in? What kind of triggers is this
Yes.
fulfilling? Am I feeding my nostalgia or my need for comfort? Right.
Yes. Or simply
Versus
responding to advertising.
Yeah.
right, right, and
Right.
how much, our
Yeah.
choices are determined by these patterns that are kind of out there, and so I love how, Alia, you brought in, like, just listening to your own body and really paying attention to that and how that can be a feedback loop of its own.
And we
and
have
I
to be
think,
aware of it because it is working.
yeah,
Now, what you guys are finding out, especially with the different therapies, the ketamine and all these, is how much you can actually intervene. So
yeah.
that's kind of a big part of your practice, isn't it? How do you interrupt these negative cycles?
Yes, that's very true. The decoupling of the default mode, right? And kind of
Yes.
really disengaging from that default system so
Yeah.
that somebody can feel motivated or think clearer
Yes.
or, think broader and expansive.
And
Yeah.
overcome negative programming from
Yes.
your second year of age.
Yeah.
Right.
Very
Which is
true.
all pre-verbal or, somewhere
And
in
I
the
think
body.
our
Hmm.
series of talks more recently has been on, it ends up going into what we talk about in narrative medicine, which is social justice. Like,
Oh.
we cannot separate the social, our society, the effect it has, the disparity that we see
Hmm.
in our communities, and it's targeted. Sugar, high fat, really processed food is delivered and targeted to, lower income, the disparities that we see.
Yeah.
Why in the schools, then we can go on and on about the effect of social, and this is a form of social injustice, and it has an effect on health, and this is what we're seeing the
Yes.
effect of that on the health, but
Perpetuation.
we're not talking, we need to look beyond that too, because speaking to that, like you said, vote with your money, go to the grocery store, that means you,
Yeah.
that's just so I want to
Yeah.
highlight that
Yeah.
that is a statement that should stick for this podcast.
Well, it's being conscious. Our choices matter, and we have choices. People say, oh, I can't really afford groceries. Well, what's the most expensive? Dairy and meat. Now, I'm not against either, but if you eat less of them and more real vegetables, your dollar goes further. So, I mean,
Yeah.
you've got choices instead of just saying, well, no, we've always done this and I feel terrible, but I feel comfortable eating this. Can we get you comfortable being happy?
I love how I'm going to just close with this image and we can switch over. Um, what you said about the adrenal fatigue and the thinning of the lips, right?
Yes.
That really speaks to, we're responding when people go for like, oh, my appearance is changing. I want to look healthier. And the solution in the marketplace is, oh, let's inject your lips without first looking at your body.
Hmm.
That's a level of injustice as well, because somebody's not putting those two things together and saying, well, actually, your adrenal fatigue is happening because you are a person who is living in conditions which are so stressful that to just survive and to be able to do those things, make those good decisions is really draining. You don't have a lot of energy. And so by just doing that lipstick on a pig, right? I mean, literally
I
just kind of
know.
like getting into that. I think we're really at this cusp of, where there's a lot of this democratization of knowledge that you're describing. There are a lot of these solutions that are coming up. And I like that when we look at these solutions, what are the lenses? What are some of the ways in which we evaluate them?
Hmm.
And how do we bring in the patient centered approach, making sure that we are paying attention to the social justice aspect,
Hmm.
not blaming the patient, but looking at the circumstances that they're embedded in, and then looking at, yeah, the treatments and the solution, not just a treatment, but a solution that's going to work with this patient's
And so many of
life.
these interactions you're talking about have to be done in a community because every one of us, in every way, are the average of our 5 closest associations. So if you're the only healthy one in the group, you're not going to be comfortable. You need to find another group or bring your group along. And maybe you're the shining light to inspire your friends and family. This has to be respected. And so you have
I
to
love that.
respect yourself first and set the example because an enlightened soul helps others by being, not by doing, not by saving other people,
Yeah.
but by an inspiration to turn them on to their own ability. And I think that's what we're aspiring to do, the three of us. But through our patients, we want them to go home and inspire other people to be better because we can be. We can be. We can walk without pain. We can not suffer from so much insult in terms of digestion and brain and all these different problems. They can be solved, but then you can bring the rest of your family along. And I don't mean bring one to my office, just
Yeah.
I think people are paying
love that.
attention. I think Peter Attia talks about this, and I've read his book more recently, and I was just, the way we kind of have to look at health span and lifespan, we really need to be focused on health span. How do you want to live as you die, as you get closer to death, how do you want to live to your death, really? And what are the ways you want to support your life as you
what's a life worth living? And
that's right.
and how many friends should you talk to rather than doing something like now I'm not against baseball, but watching baseball games and playing TV bingo. Maybe it would be more helpful to have a cup of tea with a couple of your friends.
Yeah.
I
love the tea or the Vancouver Fairy.
Beautiful. Thank you
much.
so much. Yeah. So Dr. Wick, David, it's been a wonderful conversation of curiosity and a lot of compassion and a lot of patient-centered caring. And thank you so much for the work you've done, that you continue to do. And thank you for this conversation. I think our patients and our listeners are going to find that very helpful.
How would somebody be able to contact you? Can you give us a little bit, of your links if you want it? We were happy to post that. We'll happy to post this in our show notes too.
So I'm putting up a lot of the information that I'm assembling, because I'm doing a bunch of writing now, onto a website called the Natural Facts. It's pretty presumptive, but the Natural Facts, FACTS.com. So that's a place to get perspective, similar to yours, that I've organized into larger articles and some smaller ones, some action steps that people can take. So the naturalfacts.com, that's where I've got articles up, and we'll go from there.
And I'm looking it up right now, and I'm going to
Beautiful. Thank you so much.
For my patients too. Knowledge is power, really.
Always.
Thank you.
Thank you both.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.